6:20. The nurses seem to be resolving their dispute with the government, and so do many rail workers. But the mood is very different, it seems, for junior doctors. The British Medical Association has announced there will be a 96-hour strike between April the 11th and the 15th, with no exemptions. A spokesman for NHS Providers, which represents hospital trusts in England, warned that this represented the biggest disruption from NHS walkouts so far. There should be no doubt about the scale of the impact on patients, staff, and the NHS. This has become a bitter dispute. Are the strikes really necessary? I'm joined now by Dr. Emma Runswick, junior doctor herself and deputy chair of the BMA. Thanks for joining me, Dr. Runswick. Can I start off by looking at the numbers here? Because the nurses settled for 4% and 5% over 2 years, so 9% in total. Very similar to the RMT settlement as well. You're going for 35%, which seems way out of kilter of everybody else. What justifies that?
So the nurses and other health professionals are currently voting on the offer that's been made. While our dispute is very different, we're looking for restoration, reversal of pay cuts that we have suffered since 2008. The pay cuts are about a quarter, just over a quarter, so that junior doctors now earn between £14 an hour in their first year, and after over a decade of practice and experience doing very complicated procedures and clinics, will be earning maximum £28 an hour. And we're looking to reverse those pay cuts. That's an increase of between £5 and £10 an hour, dependent on grade. We think that's perfectly reasonable. It would cost the government approximately £1 billion a year, a drop in the ocean in government spending. So it's a very different dispute. And unfortunately, the government can't even put any offer on the table, let alone a credible offer. We've received no offer, despite 3 meetings now. So yes, we're having to escalate strike action. It's really unfortunate.
Junior doctors are almost by definition relatively young workers. I wonder how much of the militancy and the anger is about what has happened to your generation when it comes to things like paying off university loans, when it comes to the housing situation, very, very hard for younger workers at the moment. What do you think?
Well, there's an element of that, certainly, but junior doctors can be in their late 30s and early 40s or older because of the length of time that training takes, particularly if you've taken time out to have children or to do research and other useful things for your development and the development of the health service and for patient care. So it's not that we're an exclusively younger workforce. However, it's certainly true that we are more affected by the student loan system. Junior doctors are often taken on over £100,000 of student-related debt. Some of that is likely to be real bank debt and credit card debt because your student loans never covered the cost of living. In university, it's certainly more difficult. We're more affected by housing costs than many other groups of workers because we have to rotate. That's a kind of compulsory part of training as a junior doctor. To be a consultant or a GP, you are moved around the country, often against your will. That might be every 6 months or every year. So you have to move and incur all the costs of renting or purchasing a house in that time. And of course, we're not any better protected from the inflation that everybody else is facing as well. So it's not necessarily just about our age, but about a number of costs that are increasing way beyond what our wages are. Everything from childcare, food, our professional costs, everything going up, but in real terms, our wages going down.
Dr. Runswick, I don't in any sense challenge the justice of that cause that you put out there. Nonetheless, this is a 96-hour strike with no exemptions. It's an all-out strike, and people's health is going to be really badly affected by it. Has that been a difficult decision for you and your colleagues to take, therefore?
I mean, striking as a doctor is always a difficult decision, but we've shown now that we can conduct strikes in a safe manner in our action in March. We are always and have always been prepared to make derogations for major incidents, mass casualty incidents like terrorist attacks or major fires, for example. But the government came to the table at 72 hours with nothing, with no serious offer, and only more preconditions. So if it takes a 72-hour strike to get them to the table, then unfortunately we're in a position where we have to increase our intensity to bring them to a serious offer. I wish that we could all be here talking about how our staffing was adequate, our wages were adequate, our friends weren't moving to Australia and New Zealand. We could all get on with looking after patients like we want to, but we're not in that position. We're in a position with a workforce crisis where our wages are so much lower than other countries and our working conditions are so much worse that we're hemorrhaging our colleagues, and we need to turn that around. We need to do something. And the government has shown no opportunity, no intention of moving despite ample opportunity. That's why we have to escalate.
Right. A really hard time ahead for your members and a hard time, of course, for patients as well. Dr. Runswick, thank you very much indeed for talking to me tonight. Now then,